So the next question is, what are two priority nursing assessments before administering furosemide? So if we're preparing to give this medication, what are two priority nursing assessments? So the priority assessments are what we're talking about are things that are critical in safely administering the medication. So that for furosemide, that means checking their blood pressure prior to administering, comparing it to what the patient's baseline is, knowing that this medication is going to lower their blood pressure. So we would use caution if it is below their normal range when we give this medication. So we want to check it first. And if we're concerned at all, we're going to notify the provider. And then we are also going to look at their electrolyte levels, especially potassium. So one of the biggest risks associated with furosemide administration is dropping their potassium level too low, causing what's called hypokalemia or low potassium levels. And that can have a lot of negative impacts, including impacts on cardiac function. So if a patient is on furosemide, we're always going to be watching their potassium levels, but we might want to check it prior to administering it so that we know to notify the provider if this patient might need a potassium supplement in addition to receiving this medication. And then other important assessments aside from the electrolyte levels and the blood pressure are going to include things like sodium levels, kidney function labs, and intake and output measurements. We might also look at those. But again, the priority assessments are going to be the ones that are critical to safely administer the medication. And the two top ones for this would be looking at their blood pressure and then looking at their electrolyte levels, especially potassium.